that was a tough day, man. Like it was, seeing that young family go through what they did, it was tough. But it's a gift in some ways, because then you really appreciate how precious life is. Like, so like you'll come home from a day like that, and when I see my boys, I'm just like, this is awesome. Like, come and hug dad. I want to play with you all the rest of the night. Let's you guys could drop kick me in the chest all that you want. You know what I mean? Like it really makes you appreciate the little things.
Dr. Kwadwo Kyeremanteng, welcome to the It's Not That Deep podcast, brother.
My man, Deepak, thank you for having me. I am a big fan of what you're throwing down. And I got to say, just like I said 2 minutes ago, that was one of the best pronunciations of my name that I've had in eons. So mad props, my friend. Mad props.
I appreciate having you on the podcast. Let's give people a little bit of an intro. You're an intensive care unit and palliative care doctor at the Ottawa Hospital. You're also founder of the Resource Optimization Network, a multidisciplinary research group working to reduce healthcare spending without compromising on care. And if I'm not mistaken, you're also an associate scientist in clinical epidemiology at Ottawa Hospital's research program. And you're also, are you still a part-time professor at Ottawa U?
All those titles are true, Deepak. It's crazy. Years of education, my friend.
That's awesome, man. And another thing that I think is very important to note is you've also got a podcast, an amazing podcast that I urge everyone to check out. We'll definitely talk about it a little bit more, and it's called Solving Healthcare. Man, I've gotten so much value from listening to that podcast, and it's just really an honor to have you here.
I really appreciate you having me, and I know we had to bail on this interview a couple times, but I am so stoked for this, my friend.
Well, I mean, I wish I could have had you here in the studio under more calm circumstances, but, we're obviously going to be addressing the elephant in the room, which is the coronavirus, COVID-19 pandemic that's affecting us all. And, we'll get into that for sure. But I want to start by giving the people a little bit of a story, a little bit of a background of your story. Tell people who you are and, how you got to, where you are today.
Well, thanks for that, Deepak. So, I mean, I started off, I was born in Edmonton, Alberta. My parents are from Ghana, and I was one of 4 kids growing up in Edmonton, and very ambitious family. 2 of my sisters are dentists, you know what I mean? Like, so it's always like, aiming to be high performers there, and grew up very active in sports. I played hockey, volleyball, basketball, soccer, everything I could touch. That'd be part of my game. And I knew for a long time I wanted to be a doc, but it took me a while to get my act together. Like I was, in undergrad, I was working in restaurants. I was a bus boy. Later, I was bartending, and so like to really get focused took a couple of years, and even between between getting undergrad and my medical degree, I took a couple of years off, got to travel a lot, got to bartend. That's where I met my wife, in fact. And then, I got into medicine, and then your whole life changes after that. Like it was obviously a big dream of mine to be able to take care of sick patients and to be able to, contribute really. And it's, for those that are aspiring to be in medicine, it is a special thing, but it's a very difficult thing. Like it's a lot of late hours. Like even now, I'll be on call for up to like 36 hours at a time. Sometimes you sleep well, sometimes you don't. and then there's just a lot of pressure, a lot of stakes when you're doing intensive care work, where someone's life's in your hands. Like, you're the last line of defense in the intensive care unit. So if our patients are on life support, they've had a trauma, they can't breathe, their blood pressure's low, and you gotta think on your toes and act fast. And so I was very attracted to that specialty because I like action. I like to think on my toes. I like the unpredictability of it all. And then my other job, I do palliative care, where you get to slow down and talk to families and patients and get to really know them and really try and help them transition to a peaceful death, which is something I take a lot of pride in. That's basically the gist of my path there.
Now, when did you know that it was this particular field in medicine that really interested you?
That's a great question. I got exposed to intensive care as a medical student, and the second I walked in the door, I was like, this is it, dog. This is it. Because I had all these questions. I was like, my initial thought was I was going to be a pediatrician, and that was a little too intense for me. Then I thought gynecology, and then surgery, emergency medicine. But when I walked into that intensive care unit at Foothills Hospital in Calgary, and I saw the action, I saw the thinking, I saw the teamwork, I was like, this is my baby right now, man. This is where I belong. So I was blessed relatively early, knowing that I wanted to do that. And I got to tell you, Deepak, it's incredible. You're working with a team of so many intelligent people that push you every day. You got nurses that are, comfortable dealing with high stakes situations, dealing with emotional situations. It's a connection. It's a team. And you're there for families during tough times. You get to walk them through the good and the bad. And you don't know what's coming through the door. You could be chilling out, everything's seems like everything's going well, and all of a sudden you get that trauma come in. All of a sudden you got that bleeding patient come in, and it's go time. It's a switch happens.
Then you're in go mode right away. And
absolutely.
Do you think that you being involved in athletics at a younger age has some role to play in that?
You know what? That is an amazing question, because we talk about, I play hockey on 2 or 3 teams, and it's a team full of docs, and you can spot because you get a bunch of residents that come through or trainees coming through. I can spot a guy that played a team sport or a girl that played a team sport from a mile away. They're the ones that are organizing the team. They're the ones that are getting you're getting stuff before you ask. They're the one trying to get the morale up in the group that are light. You know what I mean?
100%.
And so absolutely does sports help. It helps read the situation. You could read the situation. You sense how your team is going. You're good at dealing with stress. You know what I mean? If you take any form of performance sport, whether it's individual or team, most of us are accustomed to high stress situations. So absolutely, Deepak.
No, and I could completely see the parallels, but obviously what you're doing now is just slightly more high stakes than your resident hockey games. But I love that. I can see already that you've got not necessarily just a competitive spirit, but your eyes light up when there's a challenge, and so it's really cool to see how that translates then into what you're doing every day.
Can I add to that challenge piece too? One thing that, because I got 3 kids. And, all of them are really different. But my number one, Teddy, he's got that competitive drive that, he hates to lose, which it could be annoying at times, but it's hard to teach that, right? So it's hard to teach that push. Yeah. And so one thing that I still kind of, that's been innate in me too, is that, if someone tells me I can't do it, or they put me down saying, this is not going to happen, it's okay, let's go. You know what I mean? It's go time. It was just
That's
like same
awesome,
thing with
man.
medicine, same thing getting into residency. For sure, there were times where they're like, you know what, it doesn't look like you're gonna get in, and it's like, you know what, son, we're gonna ball right now, okay? We're gonna show you what time it is right now. That is one of my, rightfully or wrongfully, one of my biggest drivers, my biggest pushes. You know, the same thing happened in my research world. I approach things very different compared to a lot of my colleagues. And, you know, like not many of my colleagues like to look at costs and stuff. And, you know, some people would say, you know, that's not research. And I'm like, I'll show you. We'll show you. We'll develop a machine. So, yeah, that's an important part of my life for real, bud.
Why don't we talk about that a little bit? And, you know, in terms of you founding the Resource Optimization Network, I read this quote that you said, "From my clinical experience, I've been motivated to improve critical care and find ways to reduce costs and divert funds to places where it would be the most benefit." And that quote stuck with me a lot because as somebody who knows nothing about healthcare or medicine and the costs involved, all I know is that here in Canada, if I break my leg and I gotta go get some surgery or something, it's gonna be taken care of. I don't gotta worry about the bill up front. You know, my taxes or something. It's all just kind of sorted out, and we're good to go. But everything costs money. Everything costs money. Everyone's time costs money. The resources. Talk to me about what inspired you founding the Resource Optimization Network.
I like to tell a story to kind of put it in perspective. So when I was training, we had a guy maybe a little bit older than you that got into a bad car accident, left him quadriplegics, and had a difficult time breathing, so needed a tracheostomy. Okay, and to be able to breathe and to clear his lungs, he needed a lot of chest physio, like a physiotherapist to work on his lungs. And in that era of tax cuts and hospital cuts, the physiotherapist position was being less and less available, you know. And I was so proud. He was able to get out of the intensive care unit, and because it's a long weekend, the physiotherapists aren't there. They're not able to tap on his chest. So what happens? He gets into breathing problems. He comes back into the ICU, and he's now needing to be on a ventilator, on life support, and is all that progress. And he's like now 2 weeks, like a 2 week setback, all because we made cuts on a position that I think is so important, where we spend money on so many things that aren't benefiting patients and treatment. And to me, you know, if we could be more efficient with our resources and put them into things that actually will make patients better, like this is what we need to do. So when this happened, I'm like, man, we got to do better. Screw this, okay? And so it took, you know, as anything else in my career, a while to figure out how to do it, but eventually developed a team of researchers and clinicians that will have the same passion. And you know what? Let's look at ways where we could save healthcare money and put it into things that matter. And so that's how that kind of developed, my friend.
That's awesome, man. So what are some of the things, you know, really high level, because, you know, we obviously can't get into all the weeds of it, but what are like some, like 2 or 3 big things that can be changed that we do have the control over and can be worked on for allocation of these resources?
Yeah. So I think the number one in my world, the number one thing is to really have conversations with our loved ones about what would they want near the end of life. And because, you know, what we see is often patients that come into the intensive care unit, and intensive care unit, you're like, okay, well, no big deal. But that's literally 1% of your gross domestic product goes to taking care of patients in the ICU.
Wow.
Like a lot of, like it's a monster bill. And, you know, if you're going to come in, which is a tough course where you're going to get tubes in you, you're going to get poked, prodded, you're going to be, you won't be able to eat or drink when you want. I hope you're choosing to do that with the idea of being able to benefit from it. And a lot of patients that we find, they don't even want it, but because they never had that conversation, because they never articulated to their family, they're going through all these horrible things without any benefit. So like, it's not uncommon that we would get a 90-something-year-old person with dementia that can't even recognize their own family, that has like 3 or 4 comorbidities, health problems, and no one had that conversation. What would you want? What would they really want near the end of their life? And they end up in the intensive care unit, cost the system like $15,000 to $20,000, and they die anyway. You know what I mean? And it's, to me, this is like the biggest, like if you're gonna go bang for your buck, or the most efficient way of dealing with these things would be to just address goals of care or end of life care earlier.
And I can see how your palliative care experience, plays a big role in that. And so my mother works in a long-term care facility, and
really?
And so I hear a lot of stories. Obviously, with people's information confidential, but high-level stories about a lot of elderly patients or people who are in situations that are not able to recover, very unlikely to recover, be completely okay with, I forgot what it's called. Is it a DNR?
DNR. Yeah, absolutely. Do not resuscitate. Yeah.
Yeah, and so like I'm lucky that I can openly have these conversations with my family about, like, well, if I was ever in that situation, this is what I'd want, or if I was ever in, and so I think a lot of it starts with making that conversation a little bit more comfortable. Although it is a weird and a touchy topic, but all these kinds of things, such as end of life care, euthanasia, all these different things, it's like, okay, we should almost end the stigma and let's just talk about it.
Absolutely. Because like we're if you think about it, we're all going to die one day, and if we're more open to talk about these things, it stigmatizes it less, and we could just be more connected. Like, one of the things, Deepak, that I hate seeing in my palliative care world is sometimes people deny that they're dying, or they don't think they're dying, or don't want to address the idea that they're dying, and because of that, they don't have those meaningful conversations with their family. They'll be like a cousin or a sister that's abroad, and if they knew that they only had a few months left, maybe they would spend more time with that loved one and have meaningful interactions. But by denying the kind of not recognizing that they're dying, or not having that conversation, those magical moments don't happen. And those moments truly are magical. And one of my hugest regrets is like my old man passed away about 1.5 years ago, and I would have done anything to be able to be there when he died. And he died overseas in Ghana, and to be like, there was so many things I would have loved to have said or asked my old man before he passed, but I didn't get a chance to do that. And so I'll even say, open up about that to my patients and their families, because it's that important, I think, especially with the healing and the grieving process.
I think that's really important. And you hear stories about people being on life support for like 10 plus years, and like, how do you get that closure? Yeah. But yeah, that's I love what you're doing with the resource optimization network. That's a great initiative. But we could sit here and chat all day about that. So let's switch gears a little bit and chat the strange times that we're living in currently.
Yes.
And this is where, at first I want to really take some time to plug your podcast, Solving Healthcare, because I personally have been able to learn so much from going on this podcast and get some real facts from infectious disease experts such as Dr. Suman Chakrabarti. I think I'm saying that correctly.
No, you nailed that one too, boss.
And a pulmonologist, Dr. Nick Mark. And these guys are coming on here and they're just talking facts. And some of the things that I've learned in these 15-minute mini casts on Solving Healthcare have been like, I want everyone to hit pause right now on this episode if they're listening to this. Go subscribe to that and get educated, because all the social media in the world, all the news in the world is not going to give you the frontline facts and things that, and you guys are very much figuring it out, just like all of us, right? You're getting updates every week, every day, and this thing's evolving, and let's talk about it. So as I'm recording this right now, I think worldwide we're about 360,000 cases, 15,000 deaths. But 100,000 people have reportedly recovered as well. China, obviously, Italy, USA, Spain, and Germany, as well as Iran, are on top of that list for the most reported cases. Let's first, give the people a little bit of a quick lesson on what coronavirus is, because from what I learned on your podcast, there are more than one coronavirus, and we've had it for a while. This is just a different version.
Yeah, and forgive me, Deepak, I might have to talk out of my backside a little bit here, but yeah, like it seems like this coronavirus was stemmed from a bat. Like coronavirus, as you mentioned, is the virus of the common cold. This one stemmed from Wuhan, China, and seemed to be extremely contagious, and spread within that area quite rapidly, and now is, like, as you alluded to, is worldwide right now, and is all we can talk about and focus on. And I've been fortunate enough to talk to some of the experts in the field that have had exposure and also just know a lot about coronavirus, and it's crazy times we're in, man. But all I could tell you is, this is something. I mean, we haven't had to deal with something this level since swine flu or H1N1, and I think what we've learned from each one of these, like H1N1, SARS, is it's all about listening to our public health officials, listening to what their recommendations are. Like this social isolation movement and flattening the curve, I think, is so important. I know it's a tough time for a lot of people, a lot of families. I know we were talking about before having to be stuck in your apartment for a while now, but it's like us doing our part to try and not overwhelm the system, and I think it's what we need to do now, and hopefully it's enough. You know what I'm saying?
In your words, could you kind of explain flattening the curve to someone who might not completely understand the concept?
Yeah, no, absolutely. So the idea is, so like what you saw in Italy was that they had a huge onslaught of disease burden and a bunch of sick patients at once. And so what happened is like their capacity was overburdened. So you got a ton of patients with coronavirus, then you still have patients that have normal stuff like heart attacks, breaking their hips and all that stuff. And because the system was so overrun, you can't take care of the patients that even have treatable common problems. And so by flattening the curve, our idea is that by reducing the exposure, you are getting less people sick all at once. So instead of having just a random number, 1,000 people sick within a week, you might have 1,000 people sick over 6 months. Whereas that allows us to still operate, still be able to treat our patients that are going through like other medical conditions, to be able to stay functional.
That makes a lot of sense. And, I do think, at least here in Canada, the response has been decent, and we are now, for the most part, practicing a lot of the isolation. But you do wonder if it was enough and if it was fast enough, even though it is something that's pretty unprecedented, and there's a lot of waiting to kind of see how serious it is. But one thing that from listening to your podcast that stuck out to me, and actually it kind of makes a lot of sense, is that some of the other countries such as Iran and Italy that were so widely affected after China is because the most flights that leave those areas in China go to Italy and Tehran. So I found that very interesting that at first it was, and I think this might be even changing now, and we'll definitely get into this, but at first it was very much, let's limit travel, right? And so, what else? Another thing that I think it was Dr. Nick who was mentioning it in one of your recent podcasts is that now from a health systems level, we're actually thinking that, it's not only people who are traveling that we have to pay attention to, it's also community contact. Can you explain that a little bit?
Yeah, absolutely. So when this all started to come about, a few weeks back, what we just determined as risk factors were that you had to be traveling from a suspected area. So are you coming from Wuhan or anywhere near that province in China? And then we start to see more spread. And so then it tells you that it's not only a risk if you travel, it's a risk if it's spreading within the community. So if you have now, for example, if someone has symptoms of just, cold, upper respiratory symptoms, so fever, cough, sore throat, now we have to ask ourselves, have they been exposed to coronavirus? Because it's in our community now. And so it's now the testing is, the people that are suspected is significantly more compared to a few weeks back when it was just the traveler with symptoms.
So, speaking about symptoms a little bit, it was mentioned in one of those podcasts by Dr. Nick, and I don't want to keep mentioning him and put him on the spot or something.
Oh, no, it's all good. He's all good.
Okay with it.
Yeah.
But, he mentioned that fever is actually not a reliable indicator to rule infection in or out, and that only half of patients may have it upon presentation, and only 85% will have it at all. Can we talk about what are the symptoms that people should really be looking for and should, act on if they have them?
Yeah, and I'll preface this by always checking the public health sites too, just because, this is something that's always evolving. But the common things that we're saying is, yes, if you have fever, yes, if you have sore throat, cough, feeling unwell, feeling like you have the flu, then, those are symptoms that would be consistent with having COVID-19. So you could feel like you might have COVID-19, you might have a flu, you might have just a cold. It's tough to know exactly. It's not, you don't have specific symptoms that will say this is COVID or not. But at this rate, with the concerns of it spreading in the community, this is something that we got to rule out.
Okay, sounds good. That makes a lot of sense. And then another thing that was kind of talked about is what to do if you do have these symptoms. So something that I found very interesting, and I hadn't even initially considered, and it does come a lot back to your flattening the curve point, is that if you do present with these symptoms, don't just rush to the emergency room and infect everybody in that room, potentially. So what should people be doing? And obviously, this is all prefaced by make sure you check your public health. But what should you be doing right now?
Yeah, right now, if you're not in respiratory difficulty and you're not you don't feel like your life's in danger per se. I know it's repetitive, but I would still call the public health authority, and they will tell you, maybe you go get testing at, for example, they got the testing at the Brewer Center here in Ottawa. By the time this comes out, potentially they might come and test you at home. Who knows? Like, this is always evolving. And I should mention, we're doing this March 23rd, 2020. So, like, honestly, the way things are changing every day, every week, it's so hard to really say exactly what to do. And that's why my fallback, Deepak, is always saying, like, just check with public health, because they're telling us something new on a regular basis.
Absolutely. No, and I completely recognize your position that, that this is not something that, you can just sit here on this podcast, give one answer, and it's just going to apply forever. It's a rapidly changing situation, but definitely that makes a lot of sense. Call your public health authority, and what are some of the things that what are some ideas to make sure that people like yourself, who are very much on the front lines of this thing, are a little bit more protected?
Yeah, good question. We wash your hands, wash your hands, wash your hands. I can't. It's so motherly, but it's such an important thing. And I got to tell you, I've been working in the hospital for about 2 weeks. I've never washed my hands so much in my life. It's like these hands are raw. But you wash your hands. You do. When we do. Don't touch your face. When you're doing.
I want to talk about that a little bit. Sorry to interrupt you.
Yeah, go ahead.
I'm very guilty of this, and I know a lot of people do this, but I touch my face a lot. I read some stat that people on average touch their face 20 times an hour. How do we get people like me to just stop touching their damn face? I don't like it. It's such a wash your hands. Yeah, don't touch your face. How do we actually make that happen? How do you?
I struggle with this one too. Like I was doing. The residents were making fun of me. Actually, I did this promo video on the coronavirus, and they were like, "You touch your face all the time," like the whole video. I was like, "Really?" I looked at it again. I was like, "Oh my god, yeah."
let's
Honestly,
do that one again.
Yeah, exactly. But honestly, Deepak, you just do your best. Like like with all this stuff, I want to stress one thing is that you do your part, do your best to try and abide by these recommendations, but there's no point stressing. There's no point, like, you got to still live, right? Like, you still gotta be a human being. You're gonna touch your face. You're gonna do your best to wash your hands.
So wait, you're telling me I shouldn't be stocking up on a year's supply worth of toilet paper?
I still don't get it, actually. This conversation I have is every day is like, I don't really understand this concept. But anyways, yeah, I mean, we still got to live your life. And, what I keep telling people is just have faith in the process. There's a lot of smart people that are doing their best to stay ahead of this thing. And, from our part, it's always a bit scary because things are changing. And as you mentioned earlier on the show, we're just kind of like waiting. Like, you know what I mean? Like, we're just waiting for the shoe to drop. Like, what's this going to look like in 2 weeks? What's it going to look like in 3 weeks? We don't know, right? And so, like, I could tell you personally, and at the hospitals throughout Ontario, we're just doing our best to be ready for. You anticipate the worst and hope for the best, kind of thing.
Hope for the best. I love that. So in terms of, and now this is another kind of debated topic out there, is gloves and masks. So obviously, as a healthcare professional, you are well trained in the glove procedure and washing your hands before or after wearing them, and wearing a mask and wearing it correctly, and that kind of stuff. Well, you don't have to make a recommendation, but what do you suggest people do in regards to wearing gloves and masks?
Are you talking healthcare wise or just like people around the way? Like,
well, right now, specifically in response to this coronavirus, you're seeing some people wearing gloves and other people wearing masks, and some people obsessing of N95 masks, and other people telling you save the masks for the healthcare workers, and it's just really a lot of inconsistent messaging, and you quite frankly don't know who to listen to. So
yeah.
what's the kind of word on gloves, masks, and like how should we really be going about this?
Yeah, I mean, this is a tough question because I know for us as a healthcare professionals, these are absolutely needed. Like we know that we're at highest risk of acquiring this virus of COVID-19. And so, when we do, like in my job, we do one of the highest risk procedures of acquiring it when we put a breathing tube in somebody's lungs or any procedures that involve their lungs. We need the N95 mask. We need the glove and gown, and that it would be really a true concern if we weren't having access to that. In terms of the general public, like I will reinforce this that there's a reason we're saying wash your hands. If you got sick contacts, stay at home. The good thing about this, if you could say there's a good thing, is that, someone like yourself, if you were to acquire COVID-19, the expectation is that you would be fine. It seems to really be impacting those that are older and have multiple medical problems. So, does the public need to go buy gloves and masks? I that's not what the public health is saying. That's not what the World Health Organization is saying. That's not what the CDC is. Center of Disease. What is that? CDC.
Center of Disease
Control. Thank you, boss. They're not saying that, but so all I could say for me, I just want to make sure it's available if I got to take care of these sick patients and risk, my health.
Okay, I hear that. That makes a lot of sense. And so, pretty much it comes back to it. Check with your local authorities whether or not, if that changes or not. But as of right now, don't obsess over it.
Yeah.
Like,
okay. Put it this way. My family, I go to the hospital where, it's high risk. Nobody in my house is wearing gloves and masks. Nobody's, we're just doing all the stuff that is recommended to us, washing our hands regularly and just trying to live life in social isolation.
Absolutely, man. And it's definitely weird because I saw this this meme, and I never thought I'd be discussing memes with you, doctor, but that's just how weird things are these days, right? But it was basically like how if you had told people 6 months ago that you would be able to exclusively work from home, binge all your favorite TV shows, and stay chill with your dogs, your family, and just have basically time to explore all your creative endeavors and do all these things, it would be like, yes, everyone would sign up for it. And then you tell people it's mandatory and you got to do it, and like it's a week or 2 weeks in, and everyone's done, man.
Yeah. Is that your feeling, Deepak? Like amongst your friends and maybe colleagues at work, is that are they struggling?
I know a lot of people are struggling, and not just the physical distancing, which it probably should be called physical distancing if we're being honest, because we're not supposed to be physically in close proximity to each other. But I think it's the mental component. I think no matter all these distractions and things at home that you have and have access to, we are very much social creatures, and when you tell people that they can't be, they start to want it more, I find.
Yeah.
And so the FaceTimes and these kinds of Zoom calls are a lot more frequent, and thank God for the technology that we have, the capability to do that and still stay somewhat connected. But I gotta be honest with you, man, I don't think people will be able to do this for longer than a couple months, and that's being generous. That's just my personal opinion. I'm hoping it doesn't get to the point where there are a few people who decide to go against the recommendations, but I'm finding it already. Like, I've had to obviously go to the grocery store and visit my family and do certain things, that are still going out into the public, and I still go out for a run or for a walk just to not be cooped up in my apartment. But those things, I'm like, should I not be going to the grocery store? Should I not be going for a run? We don't have the answers for these things, I don't think. And so
well, yeah, like it's tough. I all I can say is that I hope our powers that be keep that in consideration. Like, we are social creatures. We do need to feel connected, and there's consequences to this. Like, I'm thinking of a friend's grandmother who's elderly and lives on her own and is, lonely, and loneliness kills too. So I think, I still have faith in our system that we will factor all these things in when it comes to like next steps. But I do hear you, buddy. Like, this is a challenge, but for now, this is, what we need to do.
Absolutely. And, that's without even getting into all the economic, sides of things where, a lot of people are forced to shut down their businesses or not able to pay their employees. But there are a lot of things that I think the government is trying to do in response to this and try to help out. And, I'm sure, there are ways to help each other out. And one thing that I kind of heard you guys chatting about was, trying to organize something like a collection drive for technology, for tablets and stuff to help out those grandmothers and elderly people who might be in extra level of isolation.
Yeah.
Talk to me about that a bit.
Yeah, that was Nick's idea, and I thought it was brilliant because, yeah, man, like when patients are in the hospital with COVID-19, they're like isolated, right? Like people are all in gown and gloves to see them. People are more reluctant to go into the room, and especially if they're like, some of these guys obviously aren't going to survive, and so. To be able to see family, like right now, a lot of places have a no visitor policy unless you're gonna die. That could be very lonely for our patients. So like that idea that Nick had of like having some technology available so that they can see or FaceTime with their family would be amazing. It was we were just joking, saying like this is one of the 15 things we'll put on the list of things that we're trying to do. It's always in academic medicine, there's always so much that you're trying to accomplish with limited resources, but I do think it's a brilliant idea though.
Yeah, that's so true, man. Is there anything else that you kind of wanted to chat about with COVID-19 in particular? I know that you're not allowed to get into too much detail about certain cases and that kind of stuff, but I've got some questions from friends of mine that I could get into, unless you had anything else.
Sure.
To mention.
What do you? I mean, the one thing I would mention is just. And I'm not saying this because I'm a frontline worker, but just be those that you see out there or that you personally. Just give them. They're scared. It's a scary time. So if you could, those words of encouragement, saying like we appreciate what you do, I could say personally, it means a lot. And I've seen them when they get those kind of messages, how much it means to our teams and stuff. So I would say just continue to be encouraging during this extremely challenging time.
Absolutely, man. And that goes to everyone listening to this right now. Reach out to someone. Tell them you're thankful. Yeah. So let's get into I have a few questions from friends that, maybe you might be able to help out with, maybe not.
Sure.
So how isolated does someone need to be? Let's say I become infected, but I'm showing some symptoms, but I'm not, they're not so bad that I need to go to the hospital. Can I, for example, stay in the basement with the door open with other people upstairs without infecting them? How isolated does my isolation really have to be?
Yeah, that's a good question. This is another one I often ask my our public health authorities on, but certainly the people that are in the house will have to be isolated too. So they would have to whatever we're going to recommend at the time, whether that's 7 days or 14 days, it just depends on what stage of the game. But yeah, they're going to have to be isolated. The exact proximity, I'm not 100% sure on how close you'll want to keep a distance from, but certainly the more distance, the better. But I would assume, we essentially will assume that they'll be contagious, so they'll also be isolated.
Assume you already have it and act accordingly.
Mm-hmm.
Got it. Okay, so the second question here is, if you get it once, does your chance of getting it a second time lessen since your body's already prepared to fight it off once?
That's the theory. So that's the theory that, if you get it once, that you develop an immunity to it. Some viruses will mutate relatively quick. So even, you get exposed to a cold, but a few weeks later, or you might get another cold. But the theory is that, if you get this COVID-19, you will have a level of immunity for a period of time. Obviously, it's hard to know for absolute certainty, but there's a lot unknown about is this going to, are we going to have a version 2 next year? Who knows? But certainly from a basic medical level, we assume you'll have some level of immunity.
Are there any dietary changes recommended or anything to stay away from?
As far as I'm, and once again, this is a non-expert opinion, but as far as I've come across, there's nothing specific in diet that makes you either more susceptible or protective. I would just encourage anything. Well-balanced diet. Eat them greens. Eat them protein.
That's awesome, man. Well, man, thank you so much for chatting COVID. I know it's, you only know so much. You're on the front lines and the situation's evolving rapidly. So, thanks for answering those questions. Now let's kind of switch gears a little bit and talk about you some more, man. Let's talk about some of the other things you're passionate about. Let's talk about fitness. Let's talk about nutrition. Let's talk about some of the things you do to keep yourself at peak performance.
Yeah, for me, it's I love this topic, by the way, because I as I alluded to before, I'm in my 40s now. I like to play hockey. I play hockey with a lot of young guys, guys that are in their late 20s, early 30s, and so I'm doing my best to keep up. And as you get older, you ache more. Your recovery time's longer. You're more injury prone. So I always want to try and keep the competitive edge. So a couple of things that I'm passionate about is, I like to push weight. I go to the gym as often as I can. I've been doing it since I was probably 18 years old. I love it. No better feeling than, leaving the gym after having a good workout. Always changing the routine a bit, but I do have a pretty consistent routine. Diet-wise, I've been doing the intermittent fasting for about 2 years plus, and that was a game changer for me. It's I basically kept my weight, reduced my percent body fat, and I've become stronger. And my best lifts have always been during fasted states, and it's just changed so much, and it's so freeing. I love the idea. I do the 16/8.
That's what I was gonna ask. Is what's your window looking like? Yeah.
Yeah, my window is anywhere from 16 to 18. and basically I'll have my first meal around noon, and then my last meal will be between 6 and 8 o'clock, just depending on the chaoticness of the day. But it's so convenient. You leave the house, like I shower, get my coffee, give love to the kids and mommy, and bust out. And I'm like, you're saving 15 minutes of the day, and I don't feel hungry. Like once you get used to it, like I feel great. I don't feel that kind of fog after you have a big meal like at breakfast. And my 2 meals that I eat, I get to go to town. Like I love it so much. Like I don't even think about the quantity, my friend. I just, is that another chicken breast? Okay. Is that another pork chop? Okay, let's go. Let's go. You know what I'm saying? Like it's just, it's so freeing. And
I'm
so
a big fan of intermittent fasting myself,
so you do that too, eh, bud?
Yeah, I try, and so I'll do it between Monday and Thursday. I usually fall off on Friday, Saturday, try to get back on the wagon Sunday, but I'd like to be able to do it consistently as long as you have. I love the 16-8. I love skipping the breakfast. Like you said, basically it's essentially skipping breakfast. And
that's right.
It's crazy that growing up, we were always told breakfast is the most important meal of the day. And we were always told, eat, get a big, big breakfast in. And it's like, I feel great when I just have like a coffee, like a black coffee or something. Actually, I'm lying. I don't have it black. I have the tiniest bit splash of oat milk, and I know I'm technically not fasting, but for all intents and purposes, I'm like, it's close enough.
But you know what? I wouldn't be hard on yourself. It depends who you talk to. Like some people say less than 50 calories in that window is fine. Like I put oat milk in mine. Yeah, exactly. Like some people are real extreme, but I put oat milk. That's ironic you put oat milk. But yeah, I put oat milk in my coffee too. Yeah. And Bob's your uncle. I'm ready to go. Like it's.
I love the fasted working out too. I just feel so much more nimble. Like I could just move around a bit better. You're not as bogged down by the last meal that you ate. Especially if it was higher in carbs, because I find that kind of, I might be able to lift heavier weight, which I've noticed, but I don't feel as good doing it. I don't know why, but I really do. I'm a proponent of intermittent fasting, and I know some people who do like days. I don't do all that. I like food too much.
I tried a couple of times. I tried close to 24. Like I'll have a late lunch or I'll skip lunch, and I don't personally like it. Like I'm ready to like punch a wall. You know what I mean? Like I'm just cranky. I feel a little bit. I feel more tired. So I don't find is for me, but certainly the 16-8 stuff. Like, have you done much cardio in the morning? Like, do you do cardio too, or mostly just?
I actually end up doing cardio more in the evening because I do things like kickboxing and different. Like I play flag football and different sports.
Oh, you play? Do you play with OTNFL?
NC flag, that one. I don't play the touch league, but anyways, yeah. So I do that on Sundays, and then kickboxing a couple times a week. I quite frankly don't enjoy just doing steady state cardio. It's just not fun for me.
No, I agree.
I don't enjoy just but I'll do it. I'll like a Stairmaster or like go for a 5K run or something like that. I mix it in. I'm a big ass dude, man. I'm 240 pounds of just,
You're 240?
Yeah.
Oh my God. So how tall are you?
About 6'1".
Oh man, that's beast mode right there, dog.
So the thing is, I don't love running. I feel like I'm not built for it, But you do what you got to do for cardio. So I'd like to, and now with this whole isolation stuff, I think what I'm gonna do is incorporate the cardio first thing in the morning, and do my strength training later. But we'll see, man.
Yeah, no, I'm with you though. I don't like steady cardio. I do mostly interval stuff. If I like right now, I'm not playing hockey, so like we have a elliptical in the basement, and so I'll do, like what I like to do is 30-second sprint, 1 minute,
nice,
like
hit
lower rate, and then and the nice thing about those HIIT workouts is you don't have to do it too long, right? Like it's the high intensity
like
does the trick.
25 minutes and you're good, man.
Yeah.
Yeah,
100%.
I love that. I love that.
100%.
Well, what other kind of things do you do in terms of for mindfulness? Do you practice any kind of meditation? Do you do any kind of things to keep your mind sharp?
Yeah, it's I don't know if I've ever been asked that question, but it's another thing that I'm pretty I take seriously. Like I do like my I do meditate. I don't like the guided ones. I'll just do some meditation, like focus on your breath. I guess you might call it mindful meditation. I'll do it 5 minutes after the kids go down, and I feel like it's just like a nice reset. You know what I mean? I like it. I like the ability to just like shut the brain off for a bit, and everything just feels a little bit less stressed. Everything feels a little bit more, just less intimidating. So I love that. Sometimes I'll incorporate some breathing exercises too. There's this book by Patrick McEwen, I think his name is, called Breathe. It's actually like you'll love this book. Actually, it's a good way of like improving your cardio with breath holding techniques. So like, so like one of the things, like say if you're doing a set of three reps, like say you're doing 3 deadlifts or whatever, to incorporate a little bit of cardio, hold your breath throughout the lifts. And that just adds that a little bit extra metabolic component.
Never heard of that.
I know. That's why I thought it was fascinating. I heard him on another podcast, Bulletproof, and I got hooked. So yeah, breathing exercises. I like to. I'll do the meditation, and just like I listen to other podcasts. I love audiobooks. That's what's changed my. Honestly, one of the things that has changed my life was audiobooks.
Really?
Absolutely. Because I used to go from reading a book a year on vacation, and now I go through 18 in a year.
Wow.
And whether it's like productivity, whether it's something on how to improve your podcast, like I love it. I'm just like a knowledge junkie. You know what I mean? Like I just. You're talking about how, personal growth and stuff now. Like, I don't know if it was an age thing or if it was just time, but it's just like, what can I do to be a better doc? What can I do to be a better version of me? What can I do to be a better dad? All these kind of things, I think, I'm pushing towards now. And I find reading some of that content really has been valuable.
A lot of people have been suggesting audiobooks to me. I've tried them before, and I've listened to a few, and I like an audiobook, but sometimes I just can't get with the narrator. If it's not a good narrator, it's like I keep finding myself having to rewind it and get into it. But anyways, next kind of topic, and it's kind of very much still on the personal growth stuff, is are there any types of things you do in terms of biohacking? Do you do like Wim Hof breathing? Do you do any cold showers or saunas or those kinds of things?
Yeah, so and this is another one I've never told anybody, I don't think, but I'm telling the world. I love the Wim Hof. I do the Wim Hof breathing for me, I use it for when I'm tired. It's like a way of replacing coffee for me. Just nice. Like an energy boost. It's almost meditative in a way too. But like at work, it's 3 o'clock. I'm tired. I've got 3 hours of sleep, need to refocus because there's some patients coming through the door. Do a little like 3 cycles of Wim Hof. You feel great. You feel energized. I mean, I don't do the cold shower stuff. I work out at Movati, so I'll use that sauna, but just not for the, not the biohacking reasons, just because it makes me comfortable. But yeah, I do like the I like the way the Wim Hof makes you feel, and but yeah, I've never said. I don't know if any of my friends actually know I do Wim Hof.
Well, they do now, man. That's awesome. Kind of one of the last topics, because we are kind of running out of time here. I'm sure we could sit here for hours on end and just chat, but I'll have you back on, man. We'll continue.
I love it.
But
I love it.
It is your podcast. Now, talk to me about what inspired you to actually start a podcast, and with all the other things you're doing, produce a podcast on top of it. How are you doing this?
Yeah, you know what it was, Deepak? It was the fact that we were doing all this, in my opinion, awesome research in terms of how to make healthcare better and how to save money, and nothing was changing. Nothing. You know what I mean? Like, you'd put a paper in one of the more prestigious medical journals, and in our world where we work, it didn't matter. So I was like, you know what? Maybe we'll put a voice to some of this, you know. And I love podcasts. I said, why don't we just start one and see what happens? And let me tell you, my friend, it's been beautiful. Like, things are changing. Like, it's, you know, opportunities like this, getting to meet you and other podcasters. But like, from a healthcare perspective, you know, one of the initiatives that we were gonna announce before COVID really overwhelmed us was, we got this. We had interviewed this child psychologist, Adrienne Matheson, and she talked about how if we could intervene earlier with kids, you could really prevent some mental illnesses. You could prevent some drug addiction, suicides, and all this stuff. So we started this program called Bridges Over Barriers, where we help fund this program where social workers can you know, help kids at need with basic needs. So if they needed shoes, if they needed a bus pass, they needed something to be able to, you know, just focus on their school and stuff. This is an initiative that we were going to announce soon. But yeah, you know, that came from the podcast, you know, and that means a lot to me. And then the stories you get and the recognition you get, you know, I get messages from nurse colleagues saying, like, thank you for recognizing our struggles. Thank you for seeing us. And it melts your heart. And we did another one on grieving, and you know, when I get a message every once in a while and saying how the guest on the show, Heather Busada, really helped them go through their grieving process and put things in perspective, and like we're touching lives, you know. And I just, you know, and then you telling me that, you know, the mini cast giving you a good source for information on the COVID-19 and what's coming down the pipeline, and hopefully that gives you some peace of mind, and hopefully it empowers you too. Like, this is good stuff, and I you know, I won't lie to you, like, it's something that I'm quite proud of, because it came from an idea one minute, and then we just made it into action, and now I feel like we're actually making a difference.
And you're making an incredible difference, so much impact. The initiative that you were just talking about, like, that warms my heart, man. That like the world needs that. The world needs more of that. And, you know, if you could go and, you know, we often talk about what we could do once somebody has already, you know, reactive measures, for lack of a better word, but going in and preventing. Not only does that help the person and impact that person's life, but tying it back to the resources, you're saving so much resources that can now be used to help other kind of things. So it's very, man, like, this fires me up. I need everyone to ride with this podcast, and let's make it number one. Like, I love your podcast. I love everything you're doing, man. And, like, yeah, I really appreciate you taking the time, and you know, I know you're busy. I don't know how you manage all these things that you're doing. I have no idea how you do it.
Neither do I, man.
But thank you for taking the time to come on this podcast with me. Before I let you go, we do something called a lightning round, where basically I just ask five questions to kind of end the podcast. Yeah, so let's just dive right in.
I'm excited.
Awesome, man. So question one is, what piece of advice would you give 17-year-old you?
17-year-old?
17-year-old, yeah. You could go back to time and whisper to young Kwadwo's.
Man, that's 17-year-old. So I mean, that's me in high school, just starting university. There's a couple of things. One would be like, enjoy this ride. Like when you're 17, 18, you're so worried about, am I in the right program? Am I going to get into medicine? Am I going to make my family proud? All this stuff. And some of that takes away from how much fun you're having as a 17, 18-year-old. Great friends, great people, great times. And really just, I wish even if it was this much more, to be just in the moment more, and to really embrace what you're, the fun of being that age, and also trusting yourself that it's going to be okay. You'll get to where you need to be.
I love that. Name one movie that you can rewatch over and over without getting tired of.
Whoa. This came just off the top of my head, and you might judge me. Have you seen Seven?
Yeah. Well, it's got the number 7 in the middle. Yeah.
Yeah, that, like, it was everything about Seven or Usual Suspects. Just the acting and I know if you've seen the end, you know the twist, but just like, I don't know. It was all parts of that was balling.
I'm all over those kinds of movies, man. Love it.
Yeah.
If you could dispel one myth of what it's like working in the ICU, what would it be?
That it's all like sad stuff. Like it's all like depressing cases and stuff like that. Like really, there is a lot of sadness. Like when you lose a young patient, that still is hard to take, but there's still a lot of triumph there. Like there's a lot of camaraderie. There's a lot of overcoming odds. So it's not all doom and gloom.
I know I said it's the lightning round, but I have to ask like a sub question to that.
Yeah.
How have you kind of learned to deal with that loss and those sensitive things? Like what do you do to kind of bring yourself back?
Yeah, it's a really good question. And I think part of it is like, to be able to do the job, period, you have to be able to set your emotions aside for part of that. Like you could be telling, someone that, their 40-year-old daughter is about to die. But then if someone's coming in dying or like really acutely sick from their trauma, you got to go and you got to be focused.
You got to deal with what's in front of you right there and then.
Yeah. But my practice always to take time to decompress with some of that stuff. Like whether it's me sitting down after work and taking 5 minutes to say like, man, that was fucking sad. Like that's hard. Or sitting down with my wife after the kids go down and said like, mommy, that was a tough day, man. Like it was, seeing that young family go through what they did, it was tough. But it's a gift in some ways, because then you really appreciate how precious life is. Like, so like you'll come home from a day like that, and when I see my boys, I'm just like, this is awesome. Like, come and hug dad. I want to play with you all the rest of the night. Let's you guys could drop kick me in the chest all that you want. You know what I mean? Like it really makes you appreciate the little things.
That's beautiful, man. A little bit of a lighter question. What's your favorite restaurant in the Ottawa area?
Wow. Am I allowed to say that, like, for a city this size, we don't have that many, like, gangster restaurants?
Not
you know
like
what I mean?
The craziest ones.
You know what I mean?
There's some little gems here and there sprinkled around, and that's why I like asking this question.
Yeah. So before it got burned down, Allium was our go-to. Actually, You know what? I'm going to say this. I still love going to Quinn's on Bank Street, and it's like Somerset, somewhere along that. It's like a little pub. Got the baddest burgers in town. The pizzas are fresh too. As for Quinn, he's the owner. Is that to me still is the tightest joint.
I love it, man.
Yeah.
Last and final question. How would you like people to remember you?
Wow. I want people to remember me by, there's a few things. One, that if you needed me, if you were in trouble, even if you, like, say for example, we met once, Deepak, and we connected by doing this thing. You truly needed help with something. I want to be able to be there for you. I want to be able to say that Kwadwo was reliable. He was able to help me in a time of need. That's an important thing. And the one thing that I still always want to remind myself, and this is one of the qualities I felt like my old man had, was to have some integrity, and to do the right thing. Like, if you could say that, in a time where we needed it, Kwadwo did the right thing despite the fallout. And he's able to look himself in the mirror and said, you know what, he did what needed to happen. That means a lot to me.
I love it, man. There's no better way I'd like to end this podcast. I'm gonna have you back on. We're gonna chat a lot more. And thank you for everything that you do. I really do appreciate everything that you're doing, your contributions, and just being there, genuinely saving lives, man. You're a superhero. Shout out your social media for the podcast and a website for people to find you.
Yeah, so we're everywhere. So you could find the podcast Solving Healthcare on iTunes, Stitcher, Spotify, on Instagram or Facebook or Twitter. We're at Quadcast, KWADCAST. Or comments you can leave at quadcast99@gmail.com. And the Resource Optimization Network.com is where our research group, that's a host site for our research group for those that are interested in science and medicine. But yeah, man. And let me give you some props too, Deepak. I love the show that you're doing. It's a nice release. It's a nice way of like seeing how you could easily connect with people. You have authentic conversations, and this has been, honestly, and I can speak personally because it's a stressful time. I won't lie to you. This has been so much fun, and it's just like an hour of escaping. And I gotta really thank you for the opportunity, buddy.
I appreciate the comments, man. I really appreciate you. Let's chat soon, and just remember, guys, it's not that deep.
It's not that deep. Yeah. Love it.
Thanks a lot, man.
That was fun.
That was great. Thanks for listening to another episode of the It's Not That Deep podcast. For access to exclusive articles and content, please head over to www.itsnotthatdeeppodcast.com. And to help me grow this thing to the next level, here's what I need you to do. Go ahead and subscribe to my podcast on all platforms, wherever you listen, and share with all your friends and family on all social media. And please leave a rating as well. Remember, it's not that deep.